Welcome back to Torn. I'm Dr. Mark Weigan. I'm a board-certified sports physical therapist, and the goal of this channel is dedicated to the education on the ACL. Last week we took a step back and talked a little bit more about the structures and anatomy of the knee, the bones, ligaments, meniscus, but those structures don't move the knee. The primary movers of the knee are the muscles. To understand how the knee moves, it helps to start with the two major muscle groups that control most of the motion at the knee. On the front of the thigh or the front of the leg, the anterior side, we have the quadriceps. On the back of the leg or the posterior side, meaning behind the leg, are the hamstring muscle groups. Let's start with the quadriceps. The quadriceps muscle group, as the name implies, consists of four muscles on the front of the leg or the anterior side of the leg that control the extension of the knee. So extension means the ability to get the knee straight. The four muscles are the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. Even though these are four separate muscle groups and they all originate at slightly different points up at the hip, they all work their way down the leg or the thigh and conjoin to form the quadriceps tendon. So just above the kneecap or the patella is the formation of those four muscle groups to cause the quadriceps tendon. As that tendon rolls over the kneecap, it inevitably turns into the patellar tendon, which attaches to the tibia or the shin bone. The engagement of the quadriceps or the activation of this muscle is what helps cause the formation of the straightening of the knee. So anything you can think of throughout the day, whether it's walking, going upstairs, or as we talk about sports, whether it's jumping, whether it's kicking, whether it's pushing off or accelerating, this is all coming from a straight knee, which is the engagement of the quadriceps to help form that motion. Aside from the quadriceps' ability to extend the knee or straighten the knee, so all of the different activities that I just mentioned, another significant role of the quadriceps muscle is to absorb force. So when we talk about landing positions, whether it's a double leg landing or a single leg landing, or even something like decelerating or cutting, it requires a lot of absorption force from the quad. So when we talk about these different higher level movements, it not only helps extend the knee and power and force development through these different motions like jumping and kicking, but it also helps absorb force so we don't just fall. Moving on to the hamstring. The hamstring muscle group is on the posterior side or behind the knee. So you have the hamstring muscle group consisting of the biceps femoris, the semitendinosus, and the semimembranosus. Similar to the quadriceps, the hamstring muscle group also originates up at the hip and pelvis, but runs down the back of the leg. So as it runs down the back of the leg, it crosses the joint and attaches to structures below the knee. When the hamstring contracts, it does two things. The first thing it does is helps bend the knee. So conversely to the quad where it helps extend the knee, the hamstring's job is to help bend the knee. The hamstring not only flexes the knee or bends the knee, but it also helps extend the hip. So as we discussed with the quadriceps, the ability to straighten the knee, all the different movements throughout sports that we think about, so whether it's jumping, kicking a ball, the converse of that is an example of how the hamstring works to help bend the knee and extend the hip. So a perfect example of that would be sprinting. So this is a perfect example of sports, throughout sports, that the hamstring's job is to help extend the hip, but also bend the knee. So another critical job of the hamstring muscle is as it relates to ACL injuries. So let's try and break this down. So if we look at the quadriceps muscle, the quadriceps works its way over the knee and attaches to the tibia, as we've discussed. What that does is helps pull the tibia forward. So as we mentioned, it extends the knee. So what happens when you extend the knee, that's actually placing a little bit of stress on the ACL, because the ACL's job is to help prevent the movement of the tibia going forward. So conversely, the hamstring job is to help pull the tibia backwards, which helps keep stress off the ACL. So it almost acts as a counter force. So if you have a quad dominant athlete, or an athlete who has too much of a higher ratio of quad dominance versus hamstring strength, that's going to pull the tibia too far forward and cause a little bit more strain on the ACL. So if you have a proportionate strength in the hamstring muscle, that will help counteract the amount of tibial translation or anterior tibial translation that the shin is going through, which helps reduce the force on the ACL. Although the quadriceps and hamstring muscle groups do most of the moving throughout the knee, there are other muscle groups that help stabilize and support the structures around the knee during high level movements. The calf muscles consisting of the gastrocnemius, the soleus, and the plantaris muscle, also contribute to support and movement of the knee itself. The primary motion of the calf muscle, or the combination of all three of those muscles, is to help point the foot downward. So think about stepping on a gas pedal. Pointing the foot downward is what we call plantar flexion. So think about different movements that we make throughout the day. Walking, stairs. Think about movements that we make throughout sports. So jumping, sprinting, cutting, all require the ankle to help plantar flex to push and accelerate us forward. Along the inside of the knee, running from the hip down to the knee on the inside of the leg or the medial side, we have the adductor muscle group. So during high level movements, the adductor muscle group helps support and stabilize structures on the inside of the knee, as well as help bring the leg back into midline. So that's the adduction part. Muscles along the outside of the hip, more or less considered the abductor group. So we have adduction, ADD, bringing into midline. The abductor group, AB or ab in Latin means away. So ad means toward, ab means away. But it also helps stabilize the hip and the knee during high level movements. And this is what helps with decreasing the likelihood that the knee will valgus or come inside of midline when we do different movements like cutting. So although the quadriceps and hamstring muscle groups provide most of the stability and movement throughout sports, these secondary role players, meaning the abductors, the adductors, and the calf muscles, also support movement, but also a huge amount of stability. So when we discuss the roles of the muscles and their job, the first thing we think about in the general connotation around muscles is that they help move the joint and create power. And that's certainly one thing and one of the primary things that muscles do. So when we jump, land, cut, sprint, the muscles act as primary movers of the joints and help generate power for that movement. But they also do other things, and crucially, they help stabilize the joint, but also help with neuromuscular control as we coordinate movements throughout different sports. One of the most important things that the muscles do is help coordination of the body, so neuromuscular control. Neuromuscular control is essentially the ability of the body to coordinate muscle movements during high-level sports or high-level movements in general. So the ability of the body to control movements during a cutting motion, during a jumping or landing, all of those muscles have to work together in synchrony, and that's essentially what coordination is. So it's the ability of the brain and the muscles to act accordingly based off the movement that the sport requires. So I don't want you to think of neuromuscular control as something very complicated to think about. So to break that down, think of any athlete that you've seen or watched that moves very gracefully and smoothly at their respective sport. An athlete that you can think of that you can see that moves very gracefully, that's essentially what neuromuscular control is. So it's the ability of that athlete to coordinate their muscle movements based on the requirements of their sport. So anytime that athlete cuts, jumps, lands, you can tell that their body is moving very, very effectively. This becomes very important when we're talking about an athlete who's coming back from an ACL injury. So not only is it important to work on the strength and power of the muscle, but also the neuromuscular control. Especially at the end stages of the rehab when the athlete is returning to sport, you want their movements to be very efficient and very graceful, for lack of a better term. So the neuromuscular piece of the rehab setting is very, very important. If you found this video helpful, like, subscribe, share with others that you think might benefit from this education, and we'll catch you guys in the next video.